Welcome to Deniverse. For today's topic is mouth rinses. Most of the times I'm finding patients are not using the right rinse for their condition. So let's get to it. The first rinse on the list is antimicrobials. Antimicrobials or antiseptic rinses are going to help with bacteria that is around the gum line. This bacteria is the one that causes periodontal disease, also known as gum disease. Now, rinses cannot cure periodontal disease, but they do help promote a better environment or minimize the amount of bacteria in your mouth so then this disease does not progress. I want to make that clear. A lot of the times, the a lot of the patients have the confusion that the rinse is what's going to solve the condition or the gum disease or the periodontal disease. Please, that is not true. You have to make sure that you're going in and getting your cleaning done because that's what's going to remove what's causing the periodontal disease, which is that tartar buildup and infection around the gum line. Rinses are to help promote. They're in addition to, they're not the substitute. So keep that in mind. So again, if you are experiencing gum disease or gingivitis, this is the type of rinse that you want to use. An antiseptic or also known as antimicrobial, that's going to be your rinse to use. Let's go to the second rinse on our list, and that's going to be a fluoride type rinse. The fluoride rinses are going to help and promote a better environment to prevent cavities. If you have a high number of fillings, or if you have recently went to the dentist and have a lot of cavities, you want to make sure you're using a supplemental rinse that has fluoride in it. This fluoride is important to help promote and prevent future cavities. Again, it doesn't treat cavities, just like the antimicrobial rinse does not treat periodontal disease. Rinses are supplemental to help minimize the bacteria from growing and causing more damage. Okay, another thing that I want to say about fluoride rinses is that you want to follow the instructions that are on the rinse. Usually, with fluoride rinses, you have to use them once a day at night after brushing for a minute. So make sure to read the instructions and do not dilute it with water. That's another error that I'm always finding. Please do not dilute it with water to maybe make it last a little longer. It will not be effective. It has to be in the form that it comes in the bottle. So make sure not to dilute it with water and make sure to follow the instructions on the back of the bottle. Okay, now let's go to rinse number three. Rinse number three is not as common, but it's so important if you are experiencing dry mouth that you are using this type of rinse. Patients with certain medical conditions or taking certain medications will have a higher risk of a dry mouth. A dry mouth is an opportunity for bacteria to thrive, and it's not a healthy environment. You want to make sure that you're using these type of rinses to create a more healthy environment for your mouth. Now, another rinse, I was not planning to talk about this, but another important rinse that is very cost effective is water. A lot of the times, just rinsing out with water after a meal can be beneficial in minimizing the bacteria growth and balancing the acidity levels in your mouth. Just a simple rinse of water after eating will be very helpful too. So that's just a tip that I want to make sure that you're aware of. Water is very good for you, not only just drinking it, but also rinsing with it will be very beneficial. Let me know what other questions, dental questions you have. Put them on the comments and we'll get those addressed. Thank you and have a great day.